Coming of Age is coming up next. I'm your host, Emily Echeverria. First today, we have cardiologist Dr. Brent Videau here for American Heart Month to discuss how to keep your ticker in the best possible shape. Next, Medicare. Whether you're wondering about future enrollment or changing your current plan, we've got you covered. Finally, we'll tell you about a new respite program that's part of a growing model for people with early to middle stage dementia. Stay with us. Coming of Age starts right now. As we age, staying active and connected to community can sometimes become more challenging. But with Council on Aging of West Florida's broad range of home and community-based services, you can stay healthy, independent, and engaged in life. From Meals on Wheels and respite care to senior dining sites and the retreat, we provide the support and connection you need to age your way. Aging is a unique journey for everyone, and we're here to help you meet your needs and thrive while preserving what makes you, you. Since 1972, we've been a trusted advocate for elders and a support system for those who care for them. Now, let's dive into the age-related issues that matter most to you. February is American Heart Month. During this month, health professionals raise awareness of the importance of heart health and encourage healthy habits that can help reduce the risk of heart disease. Coronary heart disease is the leading cause of death for both men and women. Here to talk to us today about living a heart-healthy life is Dr. Brent Videau. Thank you for joining me today.
Thank you, Emily. Glad to be here.
So first of all, what are some of the most common problems seen by a cardiologist?
Yeah, there's a lot of things that we see. We see things in young people, we see in old, we see palpitations, irregular rhythms. A lot of people have irregular rhythms, many times benign, but one of our jobs is to discern that. We obviously see people with chest pain, shortness of breath. That's the most worrisome symptom. There's a heart failure is very prevalent. It's a terrible word, but about 2/3 of us may have a problem with our heart as we get older. We see valve problems. We see problems with the valves that our surgeons are able to fix and operate, sometimes without open heart surgery. We see a lot of people that pass out. I see high schoolers that pass out. I mean, whenever I see and talk to somebody about it, they usually know a friend that passed out. Many times benign, but we see that. So we have a plethora of issues that involve the heart, the blood pressure. Lower extremity swelling is extremely common. And many of the things can be very benign, but a cardiologist's job is to decide what's serious and what's not so serious.
Gotcha. So as someone gets older, what are the things they can do and monitor to live longer?
Yeah.
And how does someone monitor themselves for these common heart issues?
Great question. I mean, number one is I think we've all been blitzkrieged by TV telling us what it is to live a healthy lifestyle, but it is all true. Being active, even being overweight, because many of us are, is okay as long as you're active and overweight. Getting a good night's sleep is very important. I notice you have an Apple Watch on. More and more we're living in a world where people are wearing monitors, Oura rings, Apple Watches. They're becoming a huge part of cardiology. And people will come in and say, my watch said my heart rate went up to 120, and we'll pick up a bad rhythm called atrial fibrillation, or an abnormal rhythm. So I think being aware of your body is important. And sometimes the only way to be aware is to be active. I think looking at technology as you get older, taking your blood pressure. The blood pressures in a doctor's office are wrong about 90% of the time.
Wow.
So taking it at home is very important. Monitoring your vital signs, being aware, and actually going to the doctor. That we have two groups of people. Some of us are very concerned about ourselves and come to the doctor. There are a lot of men out there that don't want to go to the doctor.
Sure.
So, yeah.
So let's talk about medications. They can be really confusing for a lot of people. There are commercials all the time about vitamins and other things to take. Who should people be believing and listening to? What should people be taking?
That's a great question, because I can go on the internet and I'll have 5 pages of things and you're like, what proof do they have? Don't watch TV at 2 o'clock in the morning and listen to the commercials, and be very careful of what you hear. If Harvard University and Mayo Clinic both have a newsletter That's about $12 a year. And that newsletter gives very good advice about medications and vitamins. Most of the things you buy over the counter or order are not FDA controlled. We have no data on them. We don't have any data on what's in an energy drink or Party Like a Rock Star or things that people do. So maybe subscribe to one of these letters from one of these universities. They have really good data. And if you're going to go on the internet, always make sure that the website ends with .org or .edu, that it's coming from an academic place. Okay, so I think that's my best advice to you.
To get that peer-reviewed, get a little bit more media literacy with these kinds of health advice that's
exactly.
out there. So if someone has high blood pressure, how do they know if they're getting the right treatment? What are the recommendations for blood pressure treatment?
And that is really a great question. There are guidelines. You can go online and look at the guidelines. You would think your doctor would know the guidelines. We do see a lot of people go to the emergency room here and just get a treatment to get them home. Mm-hmm. So how do you know if you're getting the right treatment, and what are the goals? The goals of blood pressure right now are not what you think. All of us think that you should have a blood pressure of 120/80. You should at your age, but I should at my age. 140/90 is the goal. If you take us as we get older and try to lower our blood pressure too much, somebody's going to get dizzy, you're going to fall, you're going to break a hip. You're not making people live longer. So let me, in 2 seconds, summarize. It depends on what disease you have, too. If you have diabetes, we want your blood pressure lower. If you have heart disease, we want your blood pressure lower. 140/90 is kind of a guideline for the general public. And how do you know if you're getting the right medication? I mean, literally, if you just spend a little time Googling it, you can see a chart that says this is a class of drugs they want you to start people on, second, third. Your doctor should know. Primary care doctors, cardiologists, we take care of difficult to control blood pressure if the primary can't figure it out. So I think a little investigative reporting and just being aware.
Gotcha. So tell me about the heart team at Baptist Hospital.
Yeah, we have a great heart team. I've been at Baptist Hospital. This is my only job since training at Emory. We have over 25 physicians. We have a lot of nurse practitioners, PAs. We have a huge team. And it takes that to take care of people today. It's so complex. You need people in every different specialty. And we have people that do valve surgery, we have people that take care of blood pressure, we have people take care of heart failure, congenital heart disease you're going to ask about. The bottom line is Baptist has had the same team. I've been in this group for more than 30 years. And it's very cohesive, and it all depends on communication and working together. It's a great team. It is the largest team in the city.
Awesome. So tell me just a little about modern technology and how that's affecting the diagnosis and treatment of heart disease.
Wow, these are super questions. So I just got back from it was a medical conference in Hawaii, and it was people from all over the world, and they spent an entire day talking about AI, and that's all you hear about, right? AI is going to make us better healthcare providers, better doctors. It's technology like wearable devices. Your phone, I think you all see on TV, there's a little thing you can check your EKG. All of us travel. If you have problems, you're able to go away and actually check an EKG and send it to me, or your doctor. So technology is rapidly coming in the field of medicine. It's watching what we do, and I think it's going to make us better.
Excellent. That's good news to hear.
Yes.
Well, thank you so much for being here.
I loved it. Thank you for the great questions.
Next up, we're covering the ins and outs of Medicare. Stay tuned.
Navigating healthcare is hard. Baptist makes it better. With convenient locations, easy scheduling, and skilled, compassionate doctors, all when you need us most. The next time you need care, let Baptist make it better. Baptist Healthcare.
The Respite Institute, Pensacola's ear, nose, throat, and voice center. We welcome you to visit us at our convenient Davis Highway location in Pensacola. At At the Respite Institute, we offer the most advanced treatment available in a calm, stress-free environment. Since 2014, we've performed over 1,000 cases in office of balloon sinus surgery, as well as septoplasty and nasal procedures using oral sedation. The in-office procedures result in a faster healing time. Visit us and feel the difference.
Animal Allies is looking for volunteers, and there are many ways that you can help. From taking care of cats to using your computer and social media skills, any and all assistance is greatly appreciated. We have morning and afternoon shifts every day or help at adoption events. You can even foster a kitty at home. And it counts towards community service hours for bright futures. Find Animal Allies Florida on Facebook and Instagram, or go to aaflorida.org/volunteer.
Keeping your family healthy can be complicated. Baptist makes it better with trusted primary care doctors for the whole family and trusted specialists at convenient locations throughout the region ready to care for you. All when you need us most. Let Baptist make it better. Baptist Healthcare.
If you've had some form of private or employer-sponsored insurance for most of your working life, you may be confused and anxious about signing up for Medicare. Different plans, different providers, and various limitations can be overwhelming for people who just want to make sure they stay healthy. We've got Kristen Fitzsimmons of the Benefit Shoppe joining us to explain what you need to know as you navigate this topic. Thanks for joining me, Kristen.
Absolutely. Thank you for having me.
So how soon before folks turn 65 should someone start researching or signing up for Medicare?
So theoretically, you have the 3 months prior to turning 65 that you're able to start enrolling into Medicare. But we would always suggest that the earlier, the better. It's a big subject with a vast amount of questions. So the earlier you can start learning about it, speaking about it, asking the questions with doctors, friends, family, brokers, the better off that you're going to be and prepared to go when it's ready, when it's time.
So for those that are enrolling for the first time, how is the experience different than enrolling in a private insurance plan?
It's really about the options. So with employer coverage, you have your basic HMO PPOs and you kind of know what you're going to be doing. When you enter into Medicare, you're in a whole other vast arena of options. You have traditional Medicare and Medicare Advantage and supplemental and Part Ds and penalties that can come into play. So really important to have that knowledge.
Seems like a pretty expansive topic that
Yes.
requires a lot of research. So what are the different parts of Medicare and what do they mean?
So firstly, you have your traditional Medicare, your Parts A and your Part B. That's going to cover your hospital facility, and also Part B being your doctors and physicians and things like that. Part A would be free. It's what you've paid into your entire life and earned that ability to have that at 65 years old. And then you have your Part B, which has a premium attached to it every month, or you can pay that quarterly or annually. And then, of course, you have a Medicare Advantage Part C, managed care plans. You have an option to have Medicare with a supplemental or secondary insurance. And then, of course, your Part D or prescription drug plans, which are required by Medicare, and we don't want to incur any penalties for not having that.
When is the open enrollment period?
Annual enrollment or open enrollment for everybody that is on Medicare is October 15th to December 7th. So that's the busiest time of year. It's when everybody's shopping around for their plans, whether they have traditional Medicare Advantage or supplemental. They can make any changes at that point of the year. Also, there is OEP, open enrollment, which is the beginning of the year. It's January 1st through March 31st, and that's for Advantage plan holders or traditional Medicare holders to review plans that they may want to change to. And then you have your special election periods, which are going to cover life change moments. So if you've moved, if you've gotten a divorce or married, or there's a disaster in the area.
Talk a little bit about Medicare Advantage.
Well, I don't know if I could talk a little bit about Medicare Advantage, but Medicare Advantage or Part C manages Medicare. So it moves into first payer position. Medicare pays Advantage companies to manage your care, to supply an insurance, a private-based insurance for you. Then the biggest notable difference with Advantage plans is they are what's known as an umbrella plan. So they encompass your Medicare A and B, your medical, dental, vision, hearing, and your prescription all under one roof, and typically have a low to no premium on them, though you will see copays.
Gotcha. So how can individuals receive free, non-biased counseling about Medicare?
Absolutely. So this is a very important subject matter for everybody. I would always advise getting with your local broker. These people are licensed and educated in the subject of Medicare specifically. They are involved in your communities. They are partnered with doctors and physicians and clinics alike to make sure that there's education to go around. There are other options like the Shoppe programs within each state. Those are non-licensed counselors that can kind of help guide you through the Medicare process.
Does Medicare cover things like home health, hospice, prescription drugs, and things like that?
It does. It covers all of those with the exception of the prescription drugs. Prescription drugs is required by Medicare for you to get separately, whether that be with an inclusion of an Advantage plan or you get a standalone Part D plan with traditional Medicare or even a supplemental insurance. I want to stress that you do have to have that with Medicare. Even if you don't have any prescriptions at all, you still need to have that coverage or you run the risk of incurring a lifelong penalty down the road.
And tell me about the benefits shop. If someone wants to reach out to you, they're just at the beginning of the journey, they have questions, they don't know where they're headed. How does that work?
Sure. So I'm a local agent here. I've been doing this about 5 years. I am licensed in Florida, Alabama, Mississippi, Georgia. So I'm happy to help with any type of questions that there is. If there's education needed for all of our doctor staff and assisted livings out there, I'm happy to come in and do a seminar to teach staff and residents about Medicare. I put these on quite frequently locally, so you'll see those around on the calendars and even on my website and Facebook pages.
Excellent. So hopefully some people know a little bit more about this huge topic for Medicare.
That's the goal. I so appreciate you guys having me out to get this educational information out.
Absolutely. Thanks for being here.
Thank you.
Stay with us. We're telling you about a new local respite program next.
I don't know why you're so sad. You've got a roof over your head.
Bro, you gotta stop with that depression stuff. That's a white people thing.
Escúchame, en esta casa los hombres no lloran.
You all right?
It just feels like it's coming from everywhere.
Do you want to talk about it?
Thanks for hearing me out, bro. Appreciate it.
You can talk to me if you're feeling sad. Whenever you need to talk, I'm here, okay?
Hey, let me tell you something. This is Sunshine, and I've got some information for you. When you want to check out the most informative talk show that's on the Gulf Coast, it's all here from 9 o'clock until 10 o'clock Monday through Friday, and you're going to get a repeat at 6 o'clock p.m. Then come back on Saturday afternoon if you want to watch your Friday show. You get it at 5 o'clock on Saturdays. It's Sunshine Corner, taking you where you've never gone before with all the information right here. Sunshine's Corner on Blab TV.
¿Qué color? Perfecto, mijo.
Gracias. Thank you.
What's wrong, mijo?
Donating to a pet's medical care is one of the many ways you can help families in your community. Pets and people belong together. Learn more at petsandpeopletogether.org.
A new respite program for caregivers and individuals with dementia recently opened in Pensacola. Respite for All is a social model program driven by volunteers and is best suited for those in the early to middle stages of the diagnosis. This type of program is growing across the country as the need for respite options throughout the continuum of dementia increases. And we've got Respite Coordinator Kirstin Gartner here to tell us more about the program. Thanks for joining me today, Kristen.
Thank you for having me.
So first off, explain the Respite for All model and who this model is meant to serve.
Sure, yes. So Respite is, like you said, it's a social program. And in a nutshell, we are really a high engagement, low cost social program that serves people who are in the early stages of dementia. We provide respite to their caregivers by hosting a 4-hour, 2-day-a-week session at First United Methodist Church, where participants are partnered with volunteers throughout the day. We serve lunch, we spend time doing a lot of different high engagement activities. And our respite program is actually part of a larger network of respite communities in the country underneath the Respite for All Foundation. So currently there are a little over 50 respite communities throughout the U.S.
Awesome. So who's an appropriate participant for this? Are there eligibility requirements?
Yes, there are. So the ideal candidate for respite is going to be someone who, as I said, is early in their diagnosis or early in the progression of their symptoms. Someone who is still able to enjoy a social outing and interacting with others that might not be within their immediate circle. We do require that all participants are able to ambulate independently, feed themselves independently, and use the restroom independently. And typically our friends are with us independently throughout the day, but we do have caregivers come and ease them in if they're feeling a bit hesitant about their first day at respite.
Gotcha. So what does it mean to be a social program?
Sure. So respite, like you're saying, it's a social model of care. We understand that there are a lot of people who are living with dementia who might not yet be at the stage where they need intensive medical intervention, but we recognize that everyone needs community and everyone needs friendship. So we are a group of volunteers. I am the only staff person, but our volunteers are trained to facilitate conversations, meaningful activities, and they are really trained to honor the agency of the individual with dementia.
Awesome. And when I think about Respite for All, this model, and then we have our adult daycare, the retreat, there might be some overlap, but it is a bit of a different population. It's a different stage for that journey.
It is, yes, absolutely.
So what is a day like at Respite for All? What are some examples of the activities? I see some pictures that show some really fun things that you're doing over there.
Yes. So we have a wild time at Respite. We often begin our day with brain stimulating activities like categories or storytelling or even hangman, and then we like to dial it up and do some unusual activities. We have wrapped our heads in saran wrap and covered our heads in shaving cream and thrown cheese puffs at each other. We hosted a turkey shoot during Thanksgiving, during which I dressed as a turkey and allowed our participants to hunt me throughout our building with Nerf guns. But we also focus really heavily on service projects. A lot of people who are participating in our program were volunteering within their communities prior to their diagnosis. So yesterday, for instance, we were able to pack 300 bags of food for children in Escambia County who are experiencing food insecurity. We also painted the interior of our building as a faux stained glass window. So like I was saying earlier, these activities are really oriented towards people who are able to get up and move and want to be really active during their day.
Absolutely, and I'm sure that social interaction, helps with the dementia and
Absolutely.
Just keeping them connected and in community rather than isolated.
Absolutely.
So how can people get involved to volunteer, and what types of volunteers are you looking for?
Sure. So ultimately, we are looking for people who love people. And we are looking for people who are not afraid to act a little silly sometimes, to get a little bit messy. The day that is spent with our friends is a long day. It's a 4-hour day to spend, and that can be a heavy lift for a volunteer. And the great thing about the respite model is that we operate from a large pool of volunteers. So whether you're able to come once a week, once a month, or once a year, we have a space for you in Respite. There is no obligation to come to us for, twice a week, every month. So what we can do is train on the job. With new volunteers, we will partner new volunteers with our already established volunteers. And then we'll also host a quarterly training. We hosted a kickoff training back in September, which was really successful. So we will be hosting a secondary training that will be a little bit more intensive and a little bit more one-on-one than a typical day training at Respite.
Gotcha. So tell us again the location, the times, the cost, the details, and how people can find out more or get their loved one enrolled.
Sure. So we are at First United Methodist Church of Pensacola, and we meet on Tuesdays and Thursdays from 10 a.m. to 2 p.m. The cost of the program is $40 per day, and that includes a hot lunch every day. The lunch, actually, we are often sponsored by Home Instead, so I do have to thank them for their wonderful generosity. Yes. So if you're interested in volunteering or signing up a loved one to come as a friend, you can visit fumcpensacola.com/respite, or you can email me, kgartner@fumcpensacola.com.
Gotcha. And just tell me about the response that has come from both the caregivers and the participants.
We have just seen such a wonderful response from our caregivers and from our participants and volunteers. We launched in November, and we have really become this family where we are checking in on one another throughout the week. We have our caregivers who will come in at the end of the day and pick up their loved one, and they come in and they hug, and they might participate in the last activity that we're doing. We might be doing balloon volleyball, and they'll pick up a pool noodle and hang out with us for just a little bit. And the buy-in that we have seen from our volunteers is just truly inspiring. We have seen volunteers come in and say, this is my favorite part of my week. This is bringing me back to life. And so that has just been a fantastic response. We're seeing a lot of really great growth within our volunteers and also within our participants as well.
Excellent. Yeah, I love this program model. I think it's great for our community. So thank you so much for telling us more.
Yeah, thank you for having me.
And thank you for watching. Until next time, enjoy life. You've earned it.